Okay, class. This week we are discussing the vascular supply to your brain and strokes. So we will go over some of the symptoms of stroke, some of the dysfunctions after the occlusion of the artery, and some of the assessments that are used with the stroke lines. So what is stroke? Stroke is an umbrella term applied to conditions in which blood flow to your cerebral vessels becomes disrupted, either from clotting or rupture. There are primarily two types of CVA or strokes, ischemic and hemorrhagic. Ischemic strokes are the most common type of CVA and results from thrombosis, which is a static clot, or emboli, which is a traveling clot. Hemorrhagic strokes involve bleeding into the brain tissue and can result from hypertension, aneurysm, or head injury. So hemorrhagic strokes are the most fatal type. Okay, ischemic strokes are very common, and hemorrhagic strokes are very fatal. So risk factor include age, smoking, sex. Men have 19% greater risk of stroke. Diabetes, race, again 60% of black population have a greater risk, and prior history of stroke, hypertension, obesity, high cholesterol level, and heart disease. So let's watch the video how the stroke looks like. This is a very interesting video.
Now he's been wanting to put garlic chives in everything.
Well, not everything.
Dad, the side of your face is drooping. Mom,
Probably nothing.
Dad, are you okay?
Swearing. Why are you swearing? Raise your arms up in the air for me.
Dad, are you okay?
Gracie, call 911. Honey? Tim!
Need an ambulance to 7th floor
Tim!
Avenue?
Tim, look at me, Gracie. Tell them to hurry. Tim, look at me. Look at me, Tim.
Mom, what are we
Dad, I don't know. I think he's having a stroke.
I think my dad is having a stroke.
Tim, what's going on, baby? My husband. He's cold. Are you cold, honey? Are you cold? Okay. Gracie? See, Gracie's gonna come, sweetheart. We're just gonna go in the ambulance right now. We're gonna go to the hospital. Okay? Okay. Huh? I'm right here. Gracie, meet us there. I'm right here. Okay. Okay, here we go. You just stay right here. You just stay and breathe. Just breathe. Tim?
Dad?
How you feeling?
I'm fine.
Well, you've had a stroke. But because you got here quickly, you're looking at a full recovery.
Okay, that was a very good presentation of stroke. So what is transient ischemic stroke, TIA? Well, let's see the explanation.
A mini stroke is a common expression that people use for what is more formally called a transient ischemic attack. A transient ischemic attack refers to the fact that it is temporary, it's transient, by definition lasts less than 24 hours, ischemic in that the presentation is based on decreasing blood supply to the brain. That's why you're having that event. And the attack is the description of the event, like the loss of speech, loss of vision, loss of strength, loss of sensation. People are often not sure what's happening to them. They lose vision. a gray area comes over their eye temporarily, or they can't speak for a matter of minutes or an hour, or they become weak or numb in one side of their body. Those are common presentations for so-called mini strokes. Any of those mini strokes are warning signs that something is allowing clots to block arteries or something else blocking arteries. If you have one of those transient ischemic attacks, even if they completely resolve, don't excuse them. That's a warning sign that you need to be evaluated for a source of stroke. They predict full-blown strokes in individuals. When you've had those warning signs, wisdom dictates that you're evaluated. Usually that initial evaluation is an ultrasound examination to look for the most common source of strokes, which is in the carotid artery. About 75% of strokes are due to disease in the carotid arteries, 25% are due to disease in the heart. So an ultrasound examination will evaluate the carotid arteries first. If you find significant blockages, then you consider the treatment options. There are mainly two. One is an open surgery, a so-called carotid endarterectomy, where you open the skin, dissect down onto the artery, open the artery carefully, take out the blockage, and reclose the artery. The other strategy is to do, through the vessels, placement of a stent, which involves, again, the use of tubes in the artery, the use of stents, which is a metallic frame placed inside the blockage and expanded to reopen the artery and blood supply to the brain.
Okay, so let's discuss some of the blood supply to the brain. So there are two common arteries coming from your heart. We'll watch this video.
Okay, to understand the blood supply system to your brain, we have to understand there are two main systems that are carrying blood to your brain or supplying blood to your brain. One is posterior system, which is also called vertebral basilar system or vertebral system. And one is the anterior system, which is carotid system. So we'll see how they rise from the heart and how they go up. So this is your left atrium, okay? Aortic arch, aorta. So let's see how internal or common carotid artery rise from aorta. So your common carotid artery rise from aorta. Common carotid artery. Subclavian. Okay. And here's your other subclavian artery here. Good so far? So left atrium, aorta. And this is your common carotid artery. These are your subclavian arteries. So we'll see how common carotid artery divides into internal carotid artery and external carotid artery. So here, external carotid artery and internal carotid artery. Okay. So aorta, these are common carotid arteries that they'll go up and divide into external carotid artery and internal carotid artery. So we'll name it internal carotid artery, ICA. I'm going to put ICA, and it's supplying blood to your central nervous system. Okay. Now we'll talk about vertebral artery. The vertebral system that supplies blood to your brain. Again, it's rising from subclavian artery. It goes up. It is posterior to carotid system. It goes up and turns medially. It turns medially. Okay, it goes up. and turns medially. Comes out here. Okay, and then it merges to form one artery. That's a basilar artery. This is a basilar artery. Okay, so this is your right vertebral artery. This is your left vertebral artery. All right, just a quick review. This is your left atrium. This is aorta. Aorta, in common carotid artery, rise from aorta. Then it goes up, divide into internal carotid artery and external carotid artery. Internal, and this is external. Now, vertebral system, it rises from subclavian artery. It goes up, and then it merges together to form a basilar artery. So this is the two major blood supply system there.
Okay. So as you know, carotid artery comes from aorta, divides into external and internal carotid artery, and internal carotid artery enters into your brain. It pierces through the pia mater, acromion, and appears into the subacromion space. So internal carotid artery supplies 80% blood to the anterior and middle part of the brain. Now the vertebral system or vertebral artery is the posterior blood supply system, which rises from subclavian, enters into the brain or skull from foramen magnum. It also appears through the pia mater, acromion, and appears into the subacromion space. So vertebral artery supplies blood to the cerebellum and cerebrum and brainstem. Okay, so you'll see what are the terminal branches that goes to cerebellum and cerebrum, and it is responsible for 20% of the blood supply to your posterior part of the brain. Now, anterior spinal artery, I mentioned that in the video before, but these are the arteries that are rising from the vertebral system and merging together to form one artery. That's called anterior spinal artery, which provides blood to your spinal cord, and it also provides blood to your medulla, anterior surface of medulla.